posterior compartment of the leg. So this muscle, it is a lateral head of the gastrocnemius. It is originating from the femur, that is the lateral condyle and the lateral supracondylar line of femur. The lateral supracondylar line of femur, and it goes and inserts to the Achilles tendon. There is a posterior surface of the calcaneum. Here you can see the posterior surface of the calcaneum by the calcaneal tendon, which is otherwise known as Achilles tendon, and it is innervated by the tibial nerve. And the action of this muscle of the both gastrocnemius is, there is a medial head and as well as a lateral head, is to plantar flexion at the ankle joint and flexion of leg at the knee joint. So this is the medial head of the gastrocnemius, originates from the medial condyle of femur. The rest, insertion, action and innervation are same. So this is a small muscle, this is a muscle which is a plantaris muscle, and it is originating from the lateral supracondylar line of femur at the femur bone, and it goes and inserts to the posterior surface of the calcaneum, and it is innervated by the tibial nerve, and its action is to assist in the plantar flexion of foot at ankle joint and assist in the flexion of leg at knee joint. The origin of soleus muscle. This is a soleus muscle, is from the head of the fibula and the posterior surface of the fibula, and it goes and inserts to the posterior surface of the calcaneum by calcaneal tendon. It is innervated by the tibial nerve and it plantar flexus foot at ankle joint. So this is the plantaris muscle which I have discussed. So now this is the popliteus muscle. It originates from the groove of popliteus muscle and inserts into the posterior surface of the tibia, that is superior to soleal line. Superior to soleal line. It is innervated by the tibial nerve, and it, at the beginning of the knee flexion, it medially rotate the leg at knee joint and unlock the knee joint. So next is the tibialis posterior. It originates from the posterior surface of the tibia, inferior to the soleal line. This is a soleal line, and posterior surface of the fibula and the adjacent interosseous membrane of the leg, and it goes and it inserts, goes like this, and here you can see it will be inserting to the tuberosity of navicular bone, the plantar aspect of medial, intermediate and lateral cuneiform bone, and the base of 2 to 4 metatarsal bones, and it is also supplied by the tibial nerve, and the action is to invert. It can plantar flexus the foot at ankle joint, and it invert the foot at subtalar joint. Sorry, it inversion. So now the flexor hallucis longus, long muscle to flex the great toe. It originates from the distal. This is a fibula, so it originates from the distal 2/3 of the posterior surface of fibula, adjacent interosseous membrane of leg, and it goes like this, and it is inserted at here, that is at the plantar aspect of the base of the distal phalanx of the great toe, and the action is to flex the great toe and plantar flexus foot at the ankle joint, and it is innervated by the tibial nerve. Now is the flexor digitorum longus muscle, and this muscle is originating from the posterior surface of the tibia inferior to soleal line. Here you can see, and it goes like this, and it go and inserts to the plantar aspect, base of the distal phalanx, second, third, fourth, and little toe. It is also innervated by the tibial nerve. It can flex the second, third, and fourth and little toe, and it also plantar flexes the foot at ankle joint.